So, part of my face is numb. I just had oral surgery February 21st. It was a fair experience, not too bad. I got some stitches in it. Those white things are stitches. What happened is, I guess the long story is, the backstory is that when I was 15 years old, I had a retainer. The retainer was too tight, and it kind of choked off the nervous or blood supply to the tooth that used to be there. It was the adult tooth. It was the adult tooth when I was 15, and then so the dentist at the time, they did a root canal for me because it was a dead tooth, and if they didn't, I guess eventually I would get infections or rotting and pain in there or something. So I got a root canal done, and then they decided the way to preserve the tooth and preserve some cosmesis, the aesthetics, is that they would shave down the outside of the tooth such that there was just the core of the tooth remaining, and then place a porcelain cap over it. So from 15 to now, that's like almost 35 years. 25 years of having the porcelain cap. So anyhow, so there's a porcelain cap over that root of that weakened tooth with that root canal. So there's no more real like nerve or blood supply to that core tooth there. So about 2 months ago, when I was in jiu-jitsu, I didn't wear a mouth guard, and we weren't even rolling. My bottom teeth crashed against that tooth, and I sensed, I felt, I heard a crack. And then about 2 days later, I was just eating something real light, and the tooth just cracked off. It just flipped off and just landed in my lap. What's neat is that I'd always had kind of a little bit of recurring nightmares about losing teeth. Teeth just cracking and falling off. I don't know the meaning of that. Those of you who are dream interpreters, you can tell me more about that. But it finally happened, and when it happened, instead of freaking out, I just started laughing. It was, I guess, being married and pretty solid in my life, it sucks to have a loss of tooth. I was surprised by how much it costs. This whole trying to repair this thing is going to cost upwards of $5,000, even though I'm one of the privileged ones with insurance through Canada Life. They don't cover the implant or the bone grafting that's needed to be done. Initially, in that first month, I actually asked the dentist near my office, I said, can you just glue it in for me? And he says, we don't typically do that because people accidentally swallow it when it comes off, and it's not supposed to last. But they did a good job. They glued it on, and it allowed me to do a lot of my speaking gigs, my public speaking and teaching gigs, for at least about 5 weeks before it cracked again, before where the glued interface of that old tooth actually cracked off again. So anyways, today, just about an hour ago, I was at the oral surgeon again, and this time they actually implanted some porcine bone after extracting the portion of that kind of core that's been there since I was probably 10 years old. They extracted that core of what was left up there. There was a root up there, and they extracted that, and I think they stuffed up there you can't see it, it's under the gums. They stuffed in some either bone matrix from a pig or something else, and they sewed it in there, and we have to give it a few months to mature. And I think after a few months, we should be able to screw in, I think it's screw in another false tooth in that area, and it should be relatively strong enough to maybe eventually eat apples again and stuff with my front teeth. You can see some blood there. This is just from the open wound, the gum wounds they had to dissect away some of the gum in order to place the bone grafting in there. Of course, there's sutures. It looks like there's some trauma to the gums up there in the surgical process. It looks disgusting, I'm sorry. I know it does. It'll look a lot better when it's done. I just really wanted to document this process. Right now, the pain, I'm only about 30 minutes in. I was given fentanyl, Versed, which is a sedative for conscious sedation, and a little bit of propofol. So I'm only about an hour out of that. So still feeling some of the benefits of those anesthetics. So the pain is like 0.5 out of 10 right now. I can sense that there might be some soreness within the jaw area for maybe a day or two after this. And I'm only allowed to eat soft foods for about a week. And then, a week later, these sutures will come out, and maybe that's a piece of metal there. I shouldn't play with it. Not really sure what that is. Some blood there. I'm sure the bleeding will stop probably within an hour or so, and then move on with this process. Again, I was surprised that insurance doesn't cover most of this process. It costs about 5,000 Canadian dollars, despite having insurance. Insurance will cover things like diagnostic x-rays. I think the extraction process is taken, but bone grafts and implants are considered cosmetic processes, and they're not covered by even third-party insurance. Maybe if you have some other specialized dental service plan, you might cover it, but my general benefits plan did not cover it. And these benefit plans are things that I pay extra for. As a member of Doctors of British Columbia, they have some group negotiated health benefits, and that's where I go with. It's Great Canada Life. It's called Canada Life Insurance. Anyways, I'll try to keep you up to date as the situation proceeds. I'm not allowed to wear, I had a flipper, I had a cosmetic flipper created for me by a denturist. I'm not allowed to wear that for a week, so I'll just be looking like this, going through my daily life as a doctor and parent and stuff. So anyways, not something I haven't done with before. Just want to update you. Again, pain is minimal, still quite numb because of the anesthetic, but we'll see how it goes.